Bonner County EMS System is a hybrid system utilizing most forms of EMS organizations, including fire-based EMS, third service government EMS, nonprofit volunteer, and nonprofit professional EMS. The ambulance transport agencies are all under contract and receive compensation for their services. Including first responder agencies, there are 10 fire departments actively participating in the system. Our county has become a successful model of how diverse service delivery methods can be integrated into a single system. The map you're looking at shows our almost 2,000 square mile county with call distributions plotted from an 18-month period. The darker the blue, the higher the concentration of EMS calls. Our system transport providers include Bonner County EMS with stations in Sandpoint and Priest River, Priest Lake EMTs and Clark Fork Valley Ambulance as nonprofit volunteer agencies, Newport Ambulance as a professional nonprofit agency, and Spirit Lake Fire, Sago Fire, and Schweitzer Fire as fire-based partners. Spirit Lake Fire is part of the Kootenai County EMS system, but they operate in a portion of Bonner County under a mutual aid agreement. One fire department acts as medical first responders on all types of EMS calls. Sandpoint Fire. They respond to all medical calls, basic life support, intermediate life support, and advanced life support within the city limits. And also, they staff a backup ambulance. 5 other fire departments respond only to advanced life support calls. That's Northside Fire, Clark Fork Fire, Sam Owen Fire, Westside Fire, and West Ponderay Fire. This year, we're welcoming Coolin-Kavanaugh Bay Fire in the Priest Lake area to our roster of first responders. This will bring the total number of fire departments based in Bonner County now in our EMS system at 9. This is significant because as recently as 2009, that number was only 2. The First Response Fire Agency receives supplies, equipment, training, and expense reimbursement for EMS costs. We have become and continue to strive to be a model of how diverse organizations can come together to deliver a consistent, high-quality pre-hospital care service. The key to our system continues to be collaboration. We've become leaders in the provision of rural and wilderness EMS in the state of Idaho. We chair the State Advisory Council, have representation on the Education and Exam Rules Task Force, the Agency Licensure Rules Task Force, and the Idaho Department of Transportation Strategic Plan Task Force. Our clinical practice guidelines have been adopted or are in the process of being adapted for other agencies in the state, including Kootenai County EMS. We've been invited to present our innovative programs at local, state, national, and international venues. Our total system call volume in 2012 was 4,242 calls, and about 39%, or 1,639, were dispatched as ALS, requiring a paramedic response. The countywide average response time for 2012 was 9 minutes and 4 seconds.